Good afternoon, everyone. Welcome to the CIPHI Ontario Seminar Series. I am Marina Lee, and I will be the moderator for today's webinar. A reminder that today's webinar will be in lecture mode for the duration of the call. If you have any questions, please send them through the chat pod located at the bottom right of your screen. All questions will be answered at the end of the presentation. Also, if you could please indicate in the chat pod how many people are in the room attending the webinar with you, that would be great. Okay, let's begin. So today's presentation is on the effect of food handler training certification on food premises in Ontario, presented by Raphael Barros. Raphael is an environmental health professional with the Public Health Agency of Canada. He has consulted for First Nations communities in Canada on environmental health matters, providing both regulatory public health oversight and epidemiological expertise in areas of federal and international jurisdictions. His research interests focus on the use of epidemiological research methods to shape evidence-informed decision-making, public health policy, program evaluation, and health. Please welcome Raphael.
Thanks for that introduction, Marina. It's a reminder for me to maybe shorten my bio a little bit and make it a little more easy to read. My apologies for that. I would like to, first of all, begin by thanking CIPHI Executive Ontario for inviting me in to be here today to contribute to our institute in this manner. I take it as a privilege and a pleasure to be here today, and I do hope that today's webinar session will be both fruitful to you in your field work and also efficacious as we get to learn a little bit more about the effects of food handler training in the premise inspections. So the reason why I have the University of Guelph logo there is because this was a research project that I was able to work on as part of my pursuit of an MSc in epidemiology at the University of Guelph. I'm very thankful for the connections and the networks that I was able to develop there, including Dr. Andrew Papadopoulos and Dr. Scott McEwen. And as well as Dr. Wendy Pons and Dr. Ian Young for their contributions as well to this work. So without further ado, let's begin. There we are. Okay. So basically, this is the outline for today's presentation. I'd like to start and talk a little bit about what is the context for why we decided to explore the effect of food handler training certification, as well as how it eventually impacts what we see at the inspection level. So let's start with the public health problem. What is it that we're trying to address, and what's the burden of what we're trying to see? Well, what we first see is that foodborne hazards are responsible for over 600 million cases and 420,000 deaths globally. Now, we know that the burden of illness is a lot greater in countries that are underdeveloped, but we also see that developed nations such as the United States and Canada also face tremendous challenges in trying to reduce the burden of foodborne illness. That means morbidity rates. That also means mortality rates. We don't see as many deaths here in the United States and Canada, but we still see that there is quite a challenge. Just to give you some estimates from the Public Health Agency of Canada, 4 million cases occur every year here in Canada, it's estimated. And we also see that cost estimates can range from approximately $3.7 billion to $14 billion annually. And usually when it comes to trying to estimate the cost of the burden of foodborne illness, the methodology varies quite greatly because some people only measure the direct costs associated with the burden of foodborne illness, but others do also measure the indirect costs of foodborne illness. That also means that when you're absent from work and for some reason a parent has to be at home with a child because they have an illness, those costs are not easily measured. We don't really have a good way to collect that information, that data. But that's why you see such a great variability in terms of the cost estimates. So what we also find in the literature is that we want to usually determine where is the risk setting most commonly associated with foodborne illness. And believe it or not, there is a significant proportion of foodborne outbreaks that have been attributed to food service establishments. And this is not only exclusive to foodborne outbreaks. We also know that there's lots of sporadic gastrointestinal illness cases that occur every year that because we are unable to detect them, we are unable to link them with a particular outbreak, so they go underreported in many ways. So not only foodborne outbreaks, but also sporadic cases of gastrointestinal illness contributing to this risk factor. And we see also, there was a recent study, I think by Dr. Verbova, with the Public Health Agency of Canada, that identified that food premises were a risk setting for 1/3 of all gastrointestinal illness cases in Canada, in Ontario. My apologies. So that means that there is a substantial amount of burden of foodborne illness that's attributed, that's linked with consuming foods at a food premise. The other major source, or the other major risk setting, believe it or not, is actually at the home, at our homes, right, where we're cooking our own foods, and many times we forget to apply proper food safety principles to prevent the growth of pathogenic organisms and potentially hazardous foods. But once again, it's a large chunk of all the foodborne illness that we see in Ontario. So what do we have? We do have public health legislation to help increase the oversight of food safety within the retail and food service establishments in Ontario. And primarily here in Ontario, we have the Health Protection and Promotion Act. We also have the Food Premise Regulation, which has been recently revised. Through the Food Premise Regulation, there are other oversight activities that public health inspectors in Ontario can take to minimize, to prevent foodborne illness from occurring at risk settings like food service and food retail establishments. One of them being conducting routine regulatory inspections, but also conducting HACCP audits of certain facilities, looking to see where are the critical points within the food processing, within the food preparation of a facility where there are hazards that are more likely to be associated with improper cooking procedures, improper food safety practices that eventually leave that food vulnerable to potential contamination or to susceptible to the growth of pathogenic organisms. But also, which is the main interest of the study, food handler training provision as well. And when it comes to food handler training here in Ontario, it's interesting to look at the legislative context as well. What we see is that there's been a major difference, and the paradigm shift really began in July 2018. So if we look backwards, before July 2018, the implementation of food handler training requirement was non-uniform within Ontario provincial boundaries. And the reason for that was that there was no regulatory triggers for health units to go out there and actually go and enforce food handler training requirements for food operators of food service and food retail establishments. So, but some health units took it upon themselves to enact bylaws to require certain types of food premises to have the requirement to have a food handler trained operator on site in every hour of operation. And some other health units decided not to pursue that route because they felt like the body of evidence in regards to the efficacy of food handler training was not quite there for us to take a decisive policy approach. So prior to July 2018, we had municipalities taking upon themselves to enact bylaws. Some municipalities decided to adopt food handler training requirements, others did not. But in July of 2018, the food premise regulation was revised, and we also now have a requirement for operators of food establishments to ensure the presence of at least one food handler who has completed food safety training during every hour of operations. So there is a dramatic shift. Now this gave us a little more uniformity across provinces because within provincial boundaries, and allowed a little more of consistency for us to actually look at this. So in terms of the literature, the published literature, what it has to inform us about the efficacy of food handler training, it can be summarized into basically two types of study methodologies. Some looked at food safety knowledge and attitudes before and after training. And what we found is that with those kinds of methodology, it was really hard to eventually measure if the knowledge attained from food handler training courses was actually able to translate into positive, long-lasting behavior changes and subsequently to improve food safety outcomes that will be detectable at the food premise inspection level. So that was one type of methodology. The other type of methodology usually try to compare inspection scores from establishments where staff had completed food handler training from those that did not complete food handler training requirements. And what we found was that the findings for those types of studies were very inconsistent. Some were able to find a statistically significant difference between establishments that actually had trained food handler operators, while others really couldn't really show as a statistically significant measure of association to make those inferences. So in summary, what we found was that the literature, there was not enough evidence for us to make an informed decision on the effectiveness of this policy intervention. So we found it was inadequate in many ways, maybe, and what that means is that sometimes the methodology, we weren't so confident in the steps taken. Other times it was just lack of sufficient evidence. And what we found is that it was very inconclusive. So for our study, what we tried to do is we had two major objectives that we wanted to accomplish. Number one was to measure the effect of food handler training programs as a public health intervention in improving food safety outcomes. But we also were interested in other things that we picked up from the literature. One of the biggest criticisms that were out there is that, a lot of these methodologies could not measure the effect of public health inspector level differences. So the differences amongst inspection, how much of an influence does an inspector have in the outcome of that inspection, and how that eventually impacts the efficacy of food handler training. So we wanted to measure that to have a good understanding of what was the impact of this independent variable on our study. So now we proceed to the methods. So just a little overview on the data structure that we obtained. So essentially, we had inspection reports completed by 12 public health inspectors within a Southern Ontario health unit. And the only inspection reports that we included in the analysis were from the 2017 calendar year. So the study included a total of about 1,795 inspections from 892 premises inspected by 12 public health inspectors. Inspectors verified the presence of certified food handlers in a consistent manner during their regular site visits, which also means that they were not informed of our study's hypothesis, the purpose, and also in terms of inspection methodology, the verification of food handler training usually was conducted after the inspection was done. And the way we try to control for that is that verification of the presence of food handler trainers in the premise was the very last question in the inspection forms that inspectors use. So food premises were also classified by location. We wanted to see what effect geography had on the inspection scores that we were getting for certain premises. We also wanted to see if the type of premise, meaning if it was an institutional type of premise versus a non-institutional type of premise, if that actually also had any impact on the inspection results. And they were also classified in terms of risk categorizations, which was based on annual risk assessments that health units have to undertake as part of their obligations under the public health standards. So in essence, because the health unit already pre-collected a lot of these variables that we were interested to look at, all of these secondary data information were available to us, and we were able to really look at how they impacted the outcome as well. So in terms of ascertainment, we only included in the analysis, in the statistical analysis, premises that were categorized as medium or high risk. And the reason for that is because we know that it is in medium and high risk food premises that potentially hazardous foods are being prepared, they're being manufactured or handled. And we know that because there's potentially hazardous foods there, the likelihood of disease-causing organisms growing if certain controls are not in place are higher. So that's why we focused on food preparation versus just food storage and no real food service as well. So establishments such as supermarkets, where they don't have any food handling, they were excluded from the study. So institutional versus non-institutional operations, and this is something that the health unit was able to dichotomize themselves because they collected the type of data. And they were also classified based on their affiliation with chain establishments. We thought that this was really interesting because certain studies in the literature informed that if a premise was part of a chain, a big chain, examples of that would be McDonald's, Burger King, Subway, that usually those types of premises obtain better inspection results. We wanted to see for our source population, is this the case? We also classified them in terms of predominant type of cuisine prepared and or served, and also degree of virality. In terms of the degree of virality, the health unit themselves collected this information, so we did not have to conduct very extraneous data manipulations in order to look at that effect. But in terms of chain establishments, predominant type of cuisine, what we did was we conducted a web search using the postal codes of all these establishments to see what kind of cuisine category they will fall under and what kind of premise ownership they would fall under, either chain or independently owned. So I just wanted to show the slide just to give you a snapshot of the breakdown that we use in terms of classifying premises in terms of the type of cuisine that's served. So we categorize them into six categories, yep. And so here we go, and I thought this is a good slide to share with you in case also future studies, if particular health units are looking to conduct a similar study, then they can look at some of the methodology to see if this type of classification would also suit their needs. And it's important to note that when we are looking at categorical variables such as these, we are usually comparing a particular type of cuisine type with a referring category. In our study, the referring category were unspecialized food types of cuisine. So just to give you an example, we included cafeterias, fish and chips, burgers and fries shops. Those kinds of establishments, we consider them unspecialized because they're the predominant type of cuisine that we see here in Canada. And we also had information from the health unit in terms of the inspection domains. So the health unit collected, they basically summarized the inspection methodology into 6 inspection variables. Food handler hygiene, which includes your, applying proper hand washing practices when necessary. Cooking in reheated temperature of foods. So that means they were verifying if a particular type of food was cooked to the appropriate temperature. Fish cooked to 70 degrees Celsius, for example. Hot and cold holding temperatures as well. So all those elements that are encapsulated in what we call the temperature danger zone. Foods protected from contamination, premise protection, and proper storage of foods. So we also looked at the impact of these inspection variables on the outcome itself. And in terms of the inspection results, what we really had was the health unit applied a scoring methodology, and depending on the score, the premise either received a green signage, a yellow signage, or a red signage. So what we did is we considered premises that obtained a yellow signage, which is a conditional pass, or a red signage, which is premise closure. We considered those to be substandard inspection results. And those premises that received either one of those results were considered to have failed an inspection. So we had a dichotomous outcome. We either had premises that passed an inspection or failed, and in total we had about 65 premises, 65 inspections with a failure result. And then in terms of statistical analysis, we took a model building approach to look at the effects of all these risk factor variables and their influence on the outcome. And what we really wanted to make sure was that we were able to obtain measures of association. And in terms of guiding the statistical modeling for this study, we began using causal diagrams to help us determine which variables could potentially be intervening, which variables could be confounding, to give us a good sense of how we should be interpreting variables, and should we include them in the statistical model or not, depending on what relationship they have with the outcome and also with other variables. And we also prioritize parsimony versus fit. And what that means is that we wanted to make sure that any variables that weren't giving us meaningful information, that would basically make the model a little more clunky, not obtain proper standards of errors or unstable standard errors. We wanted to make sure that variables that were not significant, did not contribute to our model significantly, were removed, because we didn't see the value they would produce from a statistical standpoint. So in terms of fixed effects model, we basically what we did was we wanted to also look at inspector level variations. So what we did, we created two different kinds of statistical models. One was a logistic regression model that had inspector as a random effect, and that's called a mixed effects logistic regression model, and also a fixed effects model where inspector is not being controlled. The effect so inspector level differences are actually removed from the statistical analysis just to see what level of impact inspector also had in that sense. So confounding for our study was determined as a statistically significant coefficient change of 20% or greater in another variable in the model, but also after looking at the causal diagram to ensure we're not removing a variable that's potentially an intervening factor or what we call an intervening variable, because those variables, if you include them in the model, you wouldn't be estimating the total effect. You're only estimating the direct effects of each variable. So we assessed interaction based on subject matter expertise. We only looked at interactions that made sense, that were plausible. And we used the mixed effects model to calculate the intra-cluster correlation factor. And with that, we're able to calculate the percentage variability using the latent variable method through Stata, which was a statistical software that we used. So we applied certain goodness of fit tests and reliability tests just to make sure that from a model assumption standpoint, that we were meeting all of those statistical model assumptions so that we can actually be more confident about the inferences that we can make on the model. And now we're going to take a quick look at the effects. So what were we able to find from our statistical modeling? One of the number one things that we're able to find was that premises without a food handler certified, without a certified food handler at time of the inspection were 2.78 times more likely to fail the inspection. And this is a fixed effects model. The mixed effects model obtained a similar result. I think it was 2.5 times more likely to fail an inspection if the premise did not have a certified food handler at the time of the inspection. And as you can see there from the confidence intervals and the statistical Walds test for this variable, they are statistically significant. We have a p-value that's under 0.05, which was the alpha value for our study. And we see that within the confidence intervals, 1 is not part of it, which would be the null for our study. So in terms of reflection, what I was thinking here is that all those in the audience could kind of take a little bit of, as I talk through some of the items, to really reflect upon this finding, that they can apply their own public health experience to explain what are some of the causalities, what are some of the reasons why premises without a certified food handler at the time of the inspection could have failed. And what we found is that one of the things that we found explains this causal effect, this potential causal effect, is the fact that food handler training, those operators that are food handler trained, they obtain food safety knowledge that are important factors in eventually preventing the onset of a series of interconnected events, starting with food safety lapses, right? When you're partaking into a food handler training course, you're learning how to properly store food. You're learning about temperature danger zones to prevent the growth of pathogenic organisms on foods that can support the growth, and which eventually could result into failed inspections, right? Because as an inspector, once you go into the facility, those are the things you are assessing. You're assessing if food is being protected from contamination. You're assessing if foods that are potentially hazardous are being properly handled, properly stored, which eventually could also cause foodborne illness. So there is an interconnected chain of events that would explain this. And what we found is that the literature, there's lots of studies in the literature that supports the same assertion. And what we also find is that there could be some lapses related to the inspection domain variables that food handler training courses do have a focus on. It has a focus on properly teaching them how to store foods, how to properly protect premises from the entrance and the harborage of pests. So, and we know that it's possible as well that food handlers that are not aware of these critical control points within the whole food processing operation that's happening in the premise, they can sometimes underestimate these variables, these food safety domain variables that are very significant. So here we have, for example, of all those 6 food safety domain variables that we had in the study, only 3 of them were statistically significant. And you can see here how much leverage they had in our model, how much an impact in terms of measures of association they had in our model. So if an inspector observed a premise where food temperatures are not properly observed, that premise was automatically 5.54 times more likely to fail the inspection. Best proofing being the strongest of all the inspection domain variables, seeing that if the inspector noticed past activity or vulnerabilities for the entrance of past activities into the building, they were significantly more likely to fail the inspection, up to 7.21 times. And we see that all of these variables were statistically significant and that the confidence interval does not include the null value. So what are some of the reasons why? I think we kind of talked a little bit about that when we talked about the effect of food handler certification as well. Food handler trained operators are looking for these variables that are part of the inspection methodology because that's how we address certain public health risks, right? They're looking at things like ensuring that foods are properly stored. They're looking at things like ensuring that the premise is properly protected, the doors are properly sealed, not to allow rodents to come into the building. They're also teaching operators about what are safe food temperature zones for particular types of foods. So we see that there's an interconnectedness between certain variables that are highly significant from a food safety perspective and food handler training as well. What we also found, which is quite interesting, is, when we looked at the premise ownership status, that was quite an interesting finding that we had. What we found was that premises classified as independently owned were protected against failing an inspection, which is actually contradictory to what another study that we found in the literature said. Another study in the literature found that premises that were chained were less likely to fail. But here, what we're seeing is premises that were actually independently owned, your typical mom and pop shops, were less likely to fail inspections. And we had other interesting findings in our statistical analysis. One of them was the fact that in univariable analysis, which means that when you're just looking at the effect of one variable, given the outcome, that we actually had the opposite relationship being statistically significant. What we had was, when you do not have all these other variables included in the model, like food handler certification, like premise risk level, that the effect of being chained was actually protective against inspection failure. But once you have all these other variables in our model, we observed the distorting effect. Basically, controlling for all those other variables allowed us to see an opposite relationship, which I thought was very interesting. And another piece of really interesting information from our statistical modeling was that when we looked at the mixed effects model, which controls for inspector variability, for the inspector variable, we saw that the statistical significance of that particular measure of association started to approach the null value, the 0.05. And that's why I wanted to include that, because it also really reiterates the importance of controlling for cluster confounding effects, like an inspector variability in this case. So let's reflect on some of the reasons why this effect, given your public health experience, because this was also a bit of a shocker to me when I looked at the statistics. What we saw is that maybe perhaps because in univariable analysis, you're not taking into consideration all these other particular important independent variables, that this distorting effect could result because of that. But once you control for all these other important variables in our model, the effect of actually being chained is actually reversed. So in our study, that's really what we found. But it's also possible that certain things like length of business ownership, pride of ownership, so these behavior factors, or even the relative magnitude of the chain operation could actually create not enough power for us to detect a true relationship, but it's something that really should trigger further studies for us to look at when we're doing our risk assessment. Should we think about premises that are chained as less risky than those that are not chained? Because that's really what the question, the root of the matter would have its application on the field. It's definitely something that warrants more study before we start applying these things into our risk assessment methodology. And then in terms of model effects, what else did we find? We found that premises that were medium risk versus high risk were less likely to fail inspection. And that's pretty intuitive from that sense, right? Because we're classifying certain premises as medium risk, we're assuming that they're less likely to have food safety violations. And our study was able to kind of find the same effect. So premises classified as medium risk were 0.34 times less likely to fail inspections. And we see that that effect was statistically significant. And I do think that there's lots of possible explanations for why our study found this. I mean, we can't we also have to think about the effect that certain PHIs, or the PHIs, or all PHIs, may hold high-risk food premises to a higher standard because they know that high-risk food premises have more extensive preparation. They're usually serving a vast, a high volume of population, and at times vulnerable populations from an immune status standpoint, and perhaps our inspectors holding them as a high standard, and that's why we're seeing this effect statistically. But another explanation for this could be the inherent nature of medium-risk food premises versus high-risk food premises. We know that medium-risk food premises, the steps in food preparation are not as complex. They're a lot simpler when compared to high-risk food premises. The volume of preparation sometimes can be quite drastic as well, and the population that they're serving are different. So it could be just that. It could be the fact that high-risk operations, they have a lot more things that we're assessing, and that's why we're seeing this effect as well. But in terms of practical significance of this particular effect, I think it provides some more validity to our methodology of conducting risk assessments. Because what we're seeing is that, yes, the premises that we're identifying as medium risk, they're less likely to fail. The premises they're identifying as high risk, more likely to fail. So I think it brings that validity. It's an effective and efficient way for health units to prioritize their resources in terms of inspection frequency, in terms of targeting food handler training, by looking at risk categorization as well. So we thought that was a very interesting effect as well. What we also found was that the odds of failing an inspection were significantly different depending on the type of cuisine served in the establishment. And this is something that we also found was very interesting. So for example, for all those premises that were categorized as South Asian cultural type cuisine, we found that they had the greatest odds of inspection failure. So restaurants in our study population classified as South Asian definitely had a significant more likelihood of failing an inspection versus those that were unspecialized. So it's a very important finding. And once again, what are some of the inferences, or what are some of the applications that we can see from that? Well, one thing that really came to mind is it's possible that inspectors, their risk perception changes once they come across a particular type of food that they're not familiar with. You know, it's part of my story as a public health inspector as well, that when I go into a premise and I'm completely unfamiliar with the type of food being served, then I will look more carefully to make sure that that food, that in terms of food acidity, that's being controlled. That in terms of water activity, that's being properly controlled. So all those all those factors that control for the growth of pathogenic organism, I will look closer into that, and that could be part of the reason why. But the fact that they're unfamiliar may create this sense of looking deeper into the food, which may allow us to see more infractions as well. But another explanation is that establishments with cultural cuisines, they may also have a greater population of food handlers that are recent immigrants to Canada, or from countries that have cultural practices and regulatory differences that are considerably different than those here in North America. And because of these differences, we're seeing that inspectors are validating that, are seeing that in the field. So, and we also found that studies have shown that ethnic and cultural groups may have unique food safety knowledge and practice needs. In order for them to comply to focus for handling operations here, it may be significantly different than there. So this is where, once again, food handler training certification provides an added value for these particular types of premises, where they're now being taught what are the things that are going to really control the pathogenic growth of organisms. What are the things that are going to protect food from potential contamination when you're preparing it this cultural way? So we thought it was really interesting that this was able to be captured from the analysis. And we also feel like it could be that this variable is an intervening factor in the relationship between cultural cuisines and increased food safety lapses. So meaning that if we look back into some of the variables that are more likely to be associated with inspection failure from a food safety domain standpoint, is that focusing on those domains for these particular cultural groups could be also a value added to them to help them understand maybe these are the variables that for our study population could significantly impact their understanding. And we also know that usually certain types of cultural cuisines, there are more complex steps in preparing those foods. It's a lot more complex to prepare rice, than it is to prepare a burger in many ways. So, or the variables in order to control rice from being a potentially hazardous food, properly cooling, properly storing, all those extra variables may be something that adds to the complexity and also makes it more likely to be picked up in an inspection. And then when it comes to the inspector level variables that we looked at, we found that inspectors were, the inspector variable was a significant variable in terms of a random effect, but that it only explained 2.1% of the variation in the data, meaning that all those things that we're seeing in the data, it's only 2.1% explained by inspector differences. So basically, about 98% of the data variations that we're seeing statistically are attributed to premise level differences. So basically, in a sense, it calms our fears about, are the inspector level differences really significantly impacting the outcome in this way? For our study, we see that it was not the case. It was a very small contributing factor to the data variations that we saw. And because it was so statistically significant, 0.0001, we also maybe feel like inspector may represent unmeasured predictor variables influencing the prevalence of inspection failure in our study population, which means that certain variables at the inspector level of interest could be how many years of public health practice does that inspector have, or professional development competence, how many years, what are the competency from a professional development standpoint differences amongst inspector? Could this explain some of the variation that we saw, even though very minimal? And we also thought maybe it could be differences in inspection methodology. I like to think of inspection as a combination of an art and science. As you grow as an inspector, we get taught the science in school, but the art of it also a lot of times comes from seeing our peers who have been in the field for many years teaching us what are some of the ways to assess. So those differences in inspection methodology could also be part of the explanation for these differences, even though minimal. Or sometimes it's the difference in food safety risk perception. Other inspectors may feel that certain critical infractions are more important than others, or that certain non-critical infractions are more important or have a higher importance than other non-critical infractions. So all things that will be interesting to look at in a future study, measuring those inspector level variables that could explain some of the significance. And then, briefly to summarize what we saw in our final models, we saw that both models produced very similar effects. So our mixed effects model that included inspectors as a random effect produced very similar results as the fixed effects model that did not have inspectors as an independent variable. And that's, in a sense, comforting to see, because it highlights to us that, once again, inspector variability is not as significant as potentially thought previously. And what we also found is that this is the first study that actually looked to measure the data variation that's attributed to that hierarchical level, the inspector level. So when I say hierarchical level, what I'm trying to paint to you is just like cows in a herd is a hierarchical level, so cows have to belong to a herd. So the premises have to belong to a particular inspector. So that's what I mean when I talk about hierarchical level. And there are variables at the inspector level that have a significance in the outcome. And as we saw in our study, most of those variables are explained at the premise level, not at the inspector level. So very interesting to see that effect. And another interesting thing to point out that I don't see in this slide, but it was in the previous slide that talked about chain versus independently owned establishments, is that when we controlled for inspector level differences, that effect, that relationship between being a chain versus independently owned, started coming to the null when it comes to inspection results. And we also noticed that the fixed effects model, from a model diagnostic standpoint, it had a better chance of meeting the assumptions. In terms of looking at goodness of fit tests, the goodness of fit test conducted for the fixed effects model gave us all really confident results. But when it came to the mixed effects model, because we only had 12 inspectors as part of the study, that's not too many inspectors at that hierarchical level. If we were to increase the number of inspectors in the study, it will be able for us to better tell if our mixed effects logistic regression model met all the assumptions. So I just wanted to briefly talk about some of the limitations in our study. One of them was the possibility of differential and non-differential misclassification of premise risk factors, and that means that, what's the effect of an inspector walking into an establishment, knowing that there's a food handler there already? Could that influence the outcome in any way? So it's something that we can't 100% control. One of the ways in this study to control for that was to have that as the last thing that they would do in the inspection, so ultimately the inspection result will be known prior to assessing the exposure factor. But we can't be 100% sure because we know inspectors are usually going to places they've been before, so it's likely that they have a pretty good knowledge. In terms of non-differential misclassification, it's really the fact that when they're assessing the outcome, they're not really basing that on other exposure factors. It's independent of the exposure itself. It can happen. What we find with non-differential misclassification usually doesn't tend to bias the measures of association as much as differential classification differences. But in this study, it's something that we can't 100% rule out because of the methodology as well. We're working with secondary data. So it's possible that the study data may not be representative of all food service and retail establishments in Ontario. Once again, we only looked at 892 premises inspected by 12 inspectors. So in order for us to be more confident about extrapolating these results to our target population, a study that includes other health units, a study that includes a larger proportion of inspectors within Ontario would help us being more representative of the source population for our study. And then it was difficult for our mixed regression model to estimate what we call best linear unbiased predictors along the normality curve. And this is one of the model assumptions. So this model assumption, we weren't able to meet it. And by having more inspectors in the study, this would help us resolving that. In terms of public health implications, we see that there's quite a few. One of them is that this study contributes to building a reliable body of evidence with regard to the effectiveness of food handler training programs. We also see that food handler training programs should be readily available to premise operators. And when we see that we can prevent inspection failure by approximately 2.5 times if we have more readily available programs, that's something that we can once again validate and hopefully to those decision makers promote and to really go out there and show the bang for the buck that food handler training certification provides from a public health perspective. We also see that this study is supportive of the policy change that occurred in Ontario in July of 2018. So it's the first study to really look at that in terms of we're seeing that no regulation will ever be perfect. Most regulations are there to set minimum standards for industry to follow, but we're definitely seeing a positive trend towards improving public health programming, improving accessibility to what I would say fundamental public health education to be conducted, and also that public health efforts to ensure food handler training programs are more accessible and relatable to operators of food premise serving cultural cuisines. So our study also points to the factor that, those premises serving different types of ethnic foods or cultural cuisines, but they would particularly benefit from food handler training certification. That's about it from my regard. I would like to take any questions that are there, but also at the same time thank the public health unit who gave us access to all this information to conduct the study, and more importantly to also Dr. Andrew Papadopoulos, Dr. Scott McEwen, Dr. Wendy Pons, and Dr. Ian Young collectively for their encouragement, their expertise, and I was able to really learn so much from being around these folks, and I'm very thankful to them in completing this. Thank you very much.
Thank you, Rafael, for that insightful presentation. Now we will just open it up to questions. So if you have any, just insert them into the chat pod.
It's okay if you guys want to digest this, the information at home. I'm not offended at all. Okay. Oh.
Just want to read them out.
Yes, I believe you will have access to the slides. It will be posted on YouTube in our CIPHI YouTube channel. So, oh, that's positive. I guess you guys like the presentation. Yes. The study was based on. So how many questions? How many inspections was the study based on? So for this study, there were the data that we had over 2,000 inspections, but those that we included in statistical analysis and descriptive statistic was 1,795 inspections. So in terms of the sample size for inspectors, why was there only 12 inspectors in the study? That was something that we couldn't really control. How many inspectors to be part of the study. So this is something that the health unit had taken the approach to start measuring. To start validating the presence of certified food handlers within their health units. And only 12 inspectors were asked to do this. So that's really the reason why. So our major role here was to analyze the data collected by these 12 inspectors. Nonetheless, it is a good question and one that I think future studies could look into. Look into having more inspectors for that same reason that we presented on earlier, so that we can better assess the mixed effects model assumptions in terms of the normality of the best linear unbiased predictor. So that's where really that information will be valuable. And also, the more inspectors, the more confident we are that data is representative of all establishments in Ontario, right? So no question. I think from a research standpoint, we always want more data. It's really all about how much can you manage. So in this case, we had 12 inspectors. We're very grateful for the work that they provided. But in the future, yeah, we'd love to, this research, research of a similar nature could also look at that as a way to improve. One of the questions was if the health unit in question had a bylaw requirement. And I'm not sure if I should answer that question because it could identify the health unit. So I'd rather not answer that. So the other question was, what was the sample size for the South Asian cuisine restaurant for this study? So the question of sample size is always a good one. In terms of sample size, what we really want to do is we want to make sure that our study has enough power to detect effects. So if the question, is to look at, do we have a sufficient sample size to make appropriate inferences, what I could say to that is that the fact that we found a difference is already significant in and of itself, given the number that we had. I don't have the exact information of how many restaurants were classified as South Asian, but it was part of the descriptive statistics of our study. So I could get back to you with that question, but I don't have that information in front of me right now. Confounding factors. So when it comes to confounders, anything that was included in the model, for confounding effects, what you want to do is you either have to control them analytically, or you exclude the confounding factors beforehand, or you try to match on the confounder. So for our study, based on our causal diagram, there were no confounders, that we included in the data set that we analyzed. So what I mean by that is there were no confounders that we could statistically detect, in a sense. When I say that, it's not that you can identify confounders by statistical significance, but when we looked at removing certain variables in our model, they weren't producing a change of a statistically significant nature. So in order to determine confounders, we looked at our causal diagram, and our causal diagram showed the relationship between all these variables in the study. So all this to say that in terms of intervening variables, they were not included in the study, but in terms of confounding effects, we were not able to find any that were based on our criteria for confounding. No, the PHIs, so the question was, did the PHIs know that they were a part of the study? No, they were not. So they were not made aware of the purpose or the hypothesis. They were instructed to collect the information, but they were not aware of the hypothesis. So, so in a sense, they're recruited into the study through a secondary nature because we're analyzing secondary data. But having said they were not aware of our hypothesis or purpose, so they were not aware. Mm-hmm.
Just stand a little bit from the back, not so close.
Oh, okay. Sorry.
Okay, that's what's making that crinkling.
Okay, awesome. Thanks, Lydia. Did you control for the population of independent versus chain? So when you're doing statistical analysis, that's something that you control for. Basically, in terms of when you're comparing different population, you definitely want to standardize the data. If you're comparing, for example, the number of premises with chain versus independent that are failing inspections with those in Saskatchewan, then you'd have to do some kind of standardization to make meaningful inferences. But in this case, the statistical approach that we implemented for our methods controls for for proportion. If we had more chain versus independently owned. So we control for those things analytically as we conduct the study. So if you'd like to provide your email address. Oh, sorry. Oh, okay, cool. Okay, would you do the same study with more than 1 year's worth of data? It goes back to what I said originally. As researchers, we're always looking for data. The more data that you can include, I personally feel the better. And the more studies that you do, the more you validate the effectiveness of certain interventions, right? So from that perspective, yeah, it would be great to look at even years, in terms of the effect. Were certain years more likely to have an influence over others? Controlling for a year, it will be an interesting thing to look at as well. But yeah, if we had more data, the better. It's always that's how I look at it, and that I'm sure that's how most researchers looking into this question would view it as well. What you want to do, though, if you have a lot of data, so if you're looking at years worth of data, then you have to then look at sampling that data, applying more of a randomized sampling, or ensure that you're, because you can't sometimes look at all the data that's in front of you, then you do that, sample size calculation to make sure that you have enough power to detect differences and things of that nature.
Any other questions?
In the audience? No? Thank you very much.
Thank you, Rafael. I would like to thank everyone present here and everyone on the webinar who joined us today for the CIPHI seminar series. It is great to have such participation online. I also ask that you reflect on how the information provided in this session can be used in your current work setting. Please ensure to complete the evaluation from the session. We would like to know what topic areas everyone would like to see presented in future webinars, and any feedback is welcome. If anyone is interested in participating in presenting at future webinars, please email professional@ciphi.on.ca. Also, just a reminder that this webinar will be posted on our YouTube channel if you'd like to review the presentation or inform colleagues who are not able to attend. I look forward to our next webinar. Thank you. Have a good day.